This video demonstrates incomplete placement of the iStent into the canal and how to rectify and fix the problem. Notice the iStent being implanted initially, the self-trepanating tip enters the canal, and you can see that the surgeon struggles with the progression of the entry of the main body within the canal. You can see that the angle of the implant does not quite follow the natural curvature of the canal, and see how the eye rotates here in a counterclockwise fashion, indicating that there is some contact with the outer wall. The stent is released, there's some blood reflux, and when we see this, it's important to get a better view, and therefore injecting further viscoelastic to displace the blood to enhance the visualization of the device helps. You can see that the device is incompletely placed in the canal. The heel is basically propped and not fully within the canal itself, and this needs to be adjusted. Here we're going to use a pair of micro-graspers. One can use a pair of micro-graspers or use the insertion device itself again to re-grasp the device. You can see that the device really has not been placed adequately within the canal itself, and you can see how it's fairly loose. We now try to push the device into the canal. You can see that the eye is rotating in a counterclockwise fashion, again indicating contact with the outer wall. Helps to now basically grab the snorkel, lift up, alter the trajectory of the device to follow the curvature of the canal, and now we see the device nicely placed within the canal, pushing on the snorkel to ensure it's sitting well flush within the canal in a proper position.